Rani is not an easy child who can be easily cuddled and cajoled. She thought she could say, a child is getting anxious at the separation. Child doesn't understand that the mother has to go to the grocery store. She has created a picture of grocery store to tell the child that this is where she is going to, but doesn't help. She still throws a tantrum. Therefore, what she thought, she has taken about several toys and she poured in front of the child. The child got attracted to the toys and got distracted from this scenario and was playing with the toys. The mother was able to go and do her job and come back. And this is a technique called distraction method to prevent tantrums.
So this is another child who developed a very strong attachment, almost an obsession with one of the classroom support assistants. So whenever she paid attention to another child, this boy would become very upset and try to grab her hair. So how would she have tackled that situation?
So most of us as pediatricians, we would have come across this behavior. So we are just going to go back into the ABC of these behaviors. So what is the function of the behavior? This Arivalagan wants some attention. He's an attention seeker. So what is the behavior here? He's obsessed. He's got a fixation to that individual, and because of this, his tantrum has escalated. So what is the antecedent which is going to be here? It is the support assistant has given attachment to another student. And what is the consequence here is, if aggression has increased, the teacher is going to leave the class. So how am I going to manage? So whenever we manage a behavior, we can have a proactive or antecedent based or a reactive strategies. Or we tell the consequence based. So it could be a proactive or reactive. Most of the time we try to use proactive strategies. That is before the behavior has occurred. So what I'm going to do here is I'm going to schedule the class with the preferred teacher. I'm going to have gradual time shifts to other students. That is, the teacher is going to go shift to other students. You get a non-contingent reinforcement. So what is a non-contingent reinforcement? Like madam has told me, you're talking too long. So Raman, you have to stop it within 2 minutes. So if this is the example, because she's already pressed the bell. So what is a non-contingent reinforcement is, before 2 minutes, madam is going to, at 1 minute, she'll give me the memento. At 1.5 minutes, she'll give me the memento again. 1 minute, 45 minutes, she'll give me the memento again. So that means 2 minutes, I've stopped the behavior. This is a non-contingent reinforcement. The next is teacher and reinforce ways to request. So he has to request, I want this. You can have some picture cards or visual clues for this. The next will be the reactive strategies. So reactive strategy is immediate withdrawal of attention. If he's aggressive, remove him of it. Move the other children to the separate library or somewhere else. And ignore the tantrums when it is safe to. Then the next will be the DRO. This is a differential reinforcement. So here what is going to happen is the same scenario. If madam has told 2 minutes, if I have completed in 2 minutes, madam is going to give me the memento. If I don't complete it in 2 minutes, if I exceed 3 minutes, she won't give me the memento again. She'll tell me start again. You're going to do the whole thing again. And wait for another 2 minutes, and then start the reinforcement.
Okay.
So the purpose of the behavior here was, what is the purpose here was, we have reduced the dependence on one staff. We have made the child to have emotional regulation. This is the most important thing we have done. This is the psychological aspect we have looked into, and promoting broader social relationships.
So this is a third case scenario with Kandan, who had faced major difficulties when he moved from play school to the local nursery. So now the mother is worried how he will handle the bigger challenge of going to a primary school itself. So how are we going to tackle this?
In this scenario, the anxiety is with the mother. She is apprehensive what will happen to the child, whether the child will be able to cope up with the new environment. The concept here is to understand the strengths of the child and strengths of the family. Calm the mind, prepare for the new environment. The mother used the picture books, role play, videos. Kandan's mother was very smart. She made a video of his new classroom and some of the key activities in the new classroom. And he had an enlivening experience even before he attended the school. So he watched the video over and over again and again. And when actually the day came when he had to go to the new school, he never had any anxiety. It is just anticipatory guidance and advanced warning.
Very good. So now there is this Sheila, who, this is a fourth case scenario. She has tantrums whenever she's taken for grocery shopping, and we do not know what her triggers are. But she felt very distressed during the experience. So what should we do in this case?
Sheila's mother was also perplexed. She was actually throwing tantrums whenever she went to a grocery school. She analyzed what was going wrong. She found that there was a sensory overload. There were bright lights, noisy surroundings, and crowded spaces. She gave a solution for all the three. Sunglasses to reduce the bright light effects, headphones and favorite music to block noise and access to a quiet room whenever the crowd was overwhelming. So the shopping now has become very calm and very safe. Again, this is an example of anticipatory actions to reduce the guidance.
Yeah.
This is just the smartness of the family.
Yeah, we face these problems when children are taken to our weddings also. Because of lot of noise we find, I've seen so many children putting both their fingers into their ears and plugging it so that they cannot hear the noise or witness all that is happening. So what we can do is noise cancellation headphones are a big boon for these children, and I've seen a lot of our children using that and benefiting a lot from it. Next case. So this is Mr. Arun. He always hated arithmetics, and when the teacher gave him a maths lesson, he would just throw a tantrum. And how did this teacher manage the situation? How did she make him learn math?
I think he was like most of us. I think we also didn't like maths. I think so. We probably had a dyscalculia. So we are going to go into the ABC. So the function of the behavior was, it was a task avoidance. He just wants to avoid maths. So the consequence was he was taken out of the class. So definitely when he has gone out of the class, he has achieved what he wanted. This is not the way we should do it. The behavior was a tantrum, and the antecedent was the maths class was at a level he could not understand. So what are the proactive strategies we are going to do, or antecedent-based activities? Task modification. You can break up the task into smaller tasks, which is simpler and to the level of his capability. And then gradually you can increase it. We can always use pictorial cues for them. So we have a picture there, we can tell them this is how it starts. You can start gradually, and you can have, because we have children with autistic children who have more of visual learning, then you can have visual supports for them. The teaching can be on a one-to-one basis. You can follow a structured routine, because all of them prefer a structured routine for them. And the other proactive strategies may be positive reinforcement, giving a lot of gifts or praises or something what he wants, and choice making. So you can always choose which are the things he wants, which are the difficult sums he can leave it. These are the things we can do it. The next thing is a high probability instructional sequence. There are two things here. There is a high probability HP sequence and a low P sequence. So what is this is high PP sequence is what are the activities he can do. And low is which he feels it he finds it difficult. So what should be our target in doing the behavior is, we should try to reduce the time between the HP and the low P. That's the low P probability.
Yeah. Oh.
The reactive strategies here will be, after he has had the problem, yes, definitely we have to remain calm. You can reduce the demands temporarily. You can ask him to do a preferred task, what he prefers. And this is the DRA in the management of this behavior. So where we try to take an alternative behavior. We use the alternative, or you can use the DRI, that is an incompatible. You search some other way of doing it. And avoiding reinforcing escape behaviors. Definitely the teacher should not take him out of the class, because he's going to escape from this behavior. And brief recovery breaks. He should need a lot of breaks. You can give him frequent breaks in the class. And always when we do this, we try to teach to have smart goals. Because whenever you give a task for this child, it should be a simple task. It should be measurable, because you cannot give him a one which he cannot do it, and which he can achieve. The task which he can do should be achieved, and it should be, that's what we call as the smart goals. He should be able to reproduce it. And
yeah. So if they can't understand the way we teach them, we have to teach them in the way they understand. Now this is Archana, who was always in the danger of trashing her home. She was constantly climbing on furniture, bouncing on chairs and sofa. Her father was always worried. He thought, let me buy a climbing frame and a trampoline and see whether she is behaving herself. So is that a good way of tackling the situation?
Yeah, but here the Archana's father, actually he is apprehensive. he has got a fear in the mind of him that while doing so, there may be accident, and he wanted to prevent accident, and therefore he, at the same time, he wanted to promote the skill of climbing, etc., in a very safe way. He wanted to nurture the skill on one side, at the same time he wanted to prevent accidents. So he bought these things where there's a climbing frame and trampoline for her to jump. So the parents used a picture of trampoline with a thick red line through it, which indicated the end of the session. Therefore, it was just a role play modeling, and the elder child also has simulated it. And finally, they were able to achieve, and there was allaying fears and demystifying fear.
Okay. So the next question is for you, sir. Again, Kumaran lost interest in academics, refused to do homework. He was always obsessed with the computer games, and his parents didn't know what to do.
Madam, this afternoon of the post-lunch, I heard one doctor saying that mullaliye edukanu. Diamond cuts diamond. So this boy was obsessed with computer games. He was forgetting everything. He was not wanting to do school sessions, school assignments, whether it be schoolwork or classwork. So the assignments piled up. And so the mother thought of a great idea. So the assignments are presented in a computer game format. Each completed assignment earns a golden key, and the golden key can be exchanged for gaming time. And therefore, this child was so keenly doing the school assignments. In the process, though it was not his goal was only to earn the hours for computer games, but he still learned his subject, and he was advancing in academics. So the special interest used as reward is the moral of the story.
So this, the eighth one, Paraman would occasionally slap his head or regurgitate his food. When he became 10, he started using slapping as a way of gaining attention. So what was he doing, attention seeking?
So again here we are going to the behavior. He was definitely slapping, it was to gain attention. So he wanted to gain some attention. And what happened here was during this time, the therapist was giving him a one-to-one session, and the slapping increased. So what the therapist did was she just fall flat and just stay still for some time. So this was the consequence which was followed here. So they wanted to withdraw the attention. So what were the proactive strategies here is, it could have been taught on alternative communication skill, because we know behaviors, it is a function where the child wants to express something. So behavior is a function which is learnt. So, and we know that anything which is learnt can be unlearned also. So that is what we're going to teach in this child. So we're going to have increased structural social interaction. So definitely if he's not able to communicate, that was the problem for him. Reinforce his appropriate behaviors and plan for regular breaks. These will be the proactive strategies. And the consequence-based strategies here was we can use the DRA and the DRI, that is using an incompatible behavior for this child to make him to do the behavior and reinforce the behavior. So next you can do is reassume lively interaction only when the slapping stops. So he lies still, and when he stops doing it, you can start back the lively interaction with the child. Definitely you can follow the process of extinction and ignoring the behavior.
So the last case is how Raji developed a habit of grabbing other youngsters in class. He enjoyed them being upset, and he enjoyed the excitement he created. Yeah. So what is the punishment, or how do we tackle this?
So this we call this as a timeout. This is called as a timeout which we give for children. This is not a positive punishment. This is a negative punishment. Where the aggression and self-injury are the most harmful types of the challenging behavior. So what do you do as a timeout is you keep the baby separately in a room. It can be in the place where he did the behavior, or you can take him separately outside. So the time duration for the behavior will be 1 minute per age. Usually we start this after around 4 years. The cognitive ability of the child should be good. So you cannot put him in, if a child has a poor cognitive ability, you cannot put him in a separate room and give timeout punishments. There should be no frightening atmosphere, and the timeout should be not inviting the child to do the behavior again. So these are the few principles you should follow.
Okay, so when you send him to a place with few distractions and sources of entertainment, it's called a timeout. So that's something that we are not normally doing here, but it works very effectively. So what are the 5 steps when you have a child with a challenging behavior? First, implement, so clear, consistent. So we have to be clear about what consequences the child will face. Positive reinforcement is the one which is being recommended. Redirect the attention. So if the child is throwing a tantrum in a shop, immediately take the child out of that place and turn his attention to something else. You give him choices. Don't think that the child cannot make up the mind. So give them the choices from which they can choose what they want to do, and model appropriate behavior. If you don't want your child to spend time on the computer or the phone, first you stop doing it. Only when you do that, when you are all the time looking at your phone and you expect your child not to do the same, then that is wrong. So when there is a challenging behavior, we first have to rule out a lot of causes. It can be due to pain. You know, these children are non-verbal. So how do they communicate that they are in pain or they are having a problem? So try to analyze all that. See whether his GI system, whether he's constipated, having a toothache, whether there is a earache, any other problem, caries or urinary problem, skin problem. Try to rule out all the medical causes. Once you have ruled out that, you check his sleep. Sleep is very, very important. See whether because these children have a problem falling asleep, they sleep very late in the night, they sleep late into the morning, they keep getting up in the middle. So all that can be the triggers for challenging behavior. So once these are all sorted, then it's kind of our role is over as a pediatrician, and then it's time for us to involve other consultants. So that's when we need to get a psychiatric opinion. That's when they will decide whether this child requires medication or not. So along with the psychotherapy that we are going to give, we are going to start on medications, review the child in 8 to 12 weeks, and then once the medications and the psychotherapy help, then you will know this child is on his way to better behavior. So these are all the non-pharmacological interventions. We have behavioral therapists nowadays and the psychologists together. These are the things: functional behavior assessment, ABA, behavioral therapy, environment modifications, skill training, communication strategies, and family counseling and support. So these are the medications which the child may have to be put on. So this also we have to know, because they will come and ask you, the psychiatrist has put us on these medicines. They'll Google and then they will find out the harmful effects of this, and they'll come and ask you, is it okay if I give them this? So usually when the child is having self-injurious behaviors, very aggressive and can cause harm to himself, that's the time when we will have to start on pharmacological interventions. So we should remember that we cannot tackle all this all by ourselves. We need the collective efforts of the teachers and the parents. Regularly we have to communicate and tell them the progress of the child, and every child is unique. Okay, I've done this for this child, the same, we discuss so many techniques of managing, but the same thing may not work with every child. So depending on the child's behavior, we need to have a tailored strategy, create a supportive environment. So see that the child also grows along with controlling the behavior. An empathetic approach. We shouldn't always blame the parents saying that you don't know how to bring up the child or you're indulging the child so much. We should have an empathetic approach, find out why the child is behaving that way. Only then we can create long-term benefits for the child. For the parents also, we have to tell them, although this child is a difficult child, set clear boundaries. So the child has to sleep at 9 o'clock, see that that happens, getting up at a particular time, following the morning routine, all that is important. Positive reinforcement is the most beneficial way of managing challenging behavior. So immediately after the child has done it, give the child a reward in some ways. When the child is throwing a tantrum, talking to the child calmly is one thing which really works. Tell them that we understand, I know that you're going through something, I know that it's troubling you, just wait, it'll pass, or something like that, taking a deep breath or a break. Tell them that you understand their emotions. So that's it from us. I thank you, panelists, for putting up with my my tantrums and getting it all together.
Madam, it was a nice experience for us to do it with you. And one song of MGR, Nalla Nalla Pillaigal Nambi. So I think he is distinguished Tappu Tavaru. What is challenging behavior is Tavaru, but not Tappu, because child is not doing it willfully. And he said
that's his way of communicating, so that we have to understand. Yes, sir.
Thank you very much, madam. It's very enlightening. Really, I would have missed this if I had not come. Really, it was very useful, because today we see not only these special children, even in the other normal children, all these scenarios we are seeing day in, day out. very difficult to manage because this needs, as you said, the counseling needs for the parents also. Parents for counseling. If the psychiatrist advise the parents to go for counseling, they are not going for counseling. There are a lot of school absenteeism. சில பசங்க அந்த ஸ்கூல் பிடிக்கலன்னு சொல்கிறாங்க, மாற்றுங்கன்னு சொன்னால் பேரண்ட்ஸும் மாற்ற மாட்டேங்கிறாங்க. they are not going for biggest டிஏவியில் படிக்கிற ஒரு பையன் வந்து அவங்க ஃபாதர் வந்து போலீஸ் ஆஃபீஸரு, mother is highly qualified, employed. The child for some reason he doesn't like that school at all. He doesn't want to go to that school. அது இவங்களுக்கு புரிய வைக்கிறதுக்குள்ள நம்மளுக்கு அவங்கள கவுன்சில் பண்ணுறதே பெரிய விஷயமா. They don't go for counseling also. Lot of challenges in today's scenario. It was very well covered, madam. Thank you so much, and thank you, Satish sir.
So because I think now parents are not always available like our parents were. So they think that they have to compensate more by materialistic ways rather than with their time. So I don't blame them also. But when a child has a problem, I think they should seek help, sir. That's what I'm saying. We are seeing suicidal tendencies in young children, even 10 and 8 years old. So we should not take it that far. Yes. 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 Thank you, sir. Thank you for it.
Thank you, ma'am. Rama ma'am, passionate developmental pediatrician, a pioneer of developmental pediatrics unit at ICH. She has been my professor. Thank you for moderating this session, ma'am. Please honor our panelists with mementos. Dr. Shivaraman, sir. Sir, you please hand over memento to ma'am, sir. Thank you so much, ma'am. That was a wonderful final session.